Okay, everyone, thank you so much for joining us today at the end of a busy spring semester. It's nice to have a chance to connect and maybe share some ideas that some of us might explore over summer while we're gearing up for another semester in fall. So I am Virginia Gray, and this is a presentation by the Faculty Development Committee within our college, and it's focusing on translating professional experience to the classroom, suggestions for pedagogy. And the topic for our presentation today came from looking at a lot of the work that our lecturer faculty do across the college, bringing in so much life experience. And also a lot of us as tenure line faculty have had really active experiences with our communities or in clinical settings. And so we just thought it would be great to have some dialogue today about how to translate those professional experiences that we have in the field to the classroom. So with us today for the presentation, we have Dr. Belinda Dougherty, who is our committee chair, joining us from the Department of Speech Language Pathology. I'm going to be introducing the presenters today and kicking us off. And then Pamela Zandre is a professor of nursing, also a member of the Faculty Development Committee. Heidi West is an assistant professor in health science. And Liana Zalikian is a lecturer in family and consumer sciences in the child development and family studies area. So again, as I mentioned, our idea came today from really how many of us in teaching settings at the university don't get formally trained on how to teach, right? Often we learn along the way. Maybe we pick up some pedagogical training through workshops that we attend that are hosted by ATS or the Faculty Center. And then sometimes through conversations with colleagues or observing colleagues, we kind of pick up some skills on teaching. And so we wanted today to give you an opportunity to hear from 4 faculty member across our college about how they've tied their professional experience to the classroom. And what you see on the screen here is a couple of screenshots from documents that guide our instruction at the kind of standards level. So at the top, you see some course objectives from a community nutrition course. And then at the bottom, you see a screenshot from a standard course outline. And I remember when I first came here as a faculty member, not really knowing what's the difference between a standard course outline and a syllabus, And so, over time, we all learned that a standard course outline is that base that every section of a course has at its most elemental level that shows how we're tying those overarching course objectives to our assessments. But then we figure out in the middle how to make that come alive to students. And we're tying our objectives to our assessments. And in the middle are those activities that we use to help students accomplish the objectives and that we measure on the evaluation side. So we're going to have a chance again for these 4 speakers to tell you about their experience. And then at the end, we will have an opportunity for you to ask questions or share some ideas that you might have. So I'm going to pass over to our first presenter, who's Dr. Dougherty.
Hi, everyone. It is a pleasure to be here. Thank you all for joining us. I am going to talk about my background from speech language pathology. So I put up just kind of our professional organizations page here, which is our motto is really making effective communication a human right, accessible and achievable for all. And I think what's really important to note in what we'll talk about throughout the theme of today is really that we are coming from these clinical backgrounds. And so how do we translate that clinical experience into the classroom with our students? Oh, next slide. I was like trying to push it myself. So as an idea, I myself come from more than a decade of clinical experience in the classroom, working with children from early intervention to young adulthood. I always wanted to come back into the class and teach, but I didn't quite get the even once I started at CSULB, how to exactly translate all of that clinical knowledge into the classroom, which is really an important factor because our students, particularly in our department, are looking to become clinical practitioners, right? The majority of them are not going to go on to become university professors. They are, in fact, going to go out and treat clients directly. So the speech language pathologist engages in professional practice in the areas of communication and swallowing across the lifespan. Our students will go on to work with children, work with adults, work with a number of different disabilities. My clinical background came from the pediatric realm. I was working with children in early intervention with language delay. I was working with children who were being diagnosed with autism. I was working with young adults on the autism spectrum, working on social skills related goals, friendship, social interaction, making friends, trying to get a job, and then working with a lot of group-based tasks. So groups with children who were minimally verbal or clinical-based settings, working with goals that were group-oriented. So these are the skills that we want our students to have once they get out into practice. But part of what I'm tasked with is then how to connect that clinical background to the classroom learning experience for the students. If you could go to the next slide for me. And really, this idea of doing this is really forefront of mind. So I published a textbook late 2022 on exactly that, which was theory to practice. So the idea of being in the classroom, reading a textbook and feeling like this isn't what's practical in the real world. This is a great textbook, but what happens when, the kid comes in and they've had a bad day, or you had a really great lesson plan, but you left your bag in the car, right? There are really practical things that happen when you are a practitioner that I wanted to better capture. And so the essence of a lot of what I'll talk about today kind of comes from this idea of theory to practice. That really the core purpose with my clinical background is to train future working professionals who will then work as speech language pathology assistants or work as speech language pathologists, and that kind of field experience is really valuable and needed to really extend that textbook knowledge to clinical practice. So we would have some feedback from people out in the field who would work with our students saying that, oh, they're just really green and they don't quite, they're really rigid about the client has to fit this profile, and people don't fit profiles. And so that doesn't quite work. So I really wanted to focus on ways to connect what they're reading in, chapter 4 to who they're going to see across from the desk from them in a few months. If you go to the next slide for me. So I'll talk about some of the practices that I've done in the classroom over the last several years. Almost every class that I do has some kind of clinical case study embedded. 9 times out of 10, those clinical case studies are coming from clients I hands-on have worked with or continue to work with presently. So oftentimes those are messier, right? So they're not as clean as the students would like them to be. They are from students who have multilingual backgrounds, who have diagnoses that are maybe not so clear, who have parents who may or may not buy into the intervention that you're trying to work with them on. So I try to bring in clinical case studies into every class that are centered around a person, around a client, around a case. And I'll say things like, okay, so, John, in this case, he is 7. So what is your lesson plan? What are you going to do with this client who comes in? And a student might come up with something that's really, really scientifically sound and great. And I'll say, oh, but, he really is bored and he doesn't like, just sitting at the table. So what are you going to do instead? And so getting them to think a little bit more outside the box and getting them to adapt their textbook knowledge to the actual person that they'll have to adapt that to. So clinical case studies involved in every single class. I'll include real reports. So either an evaluation report that I wrote or a progress note that I wrote. And I'll say, this is something that you might see out in the real world. How would you take this? And how does this client present to you based on this information? And they'll have to interpret that information. I always make sure that the cases are messy. And that, again, usually I'm not trying that hard because clients are messy and people are not neat and clean and fit in their little boxes. I always, always, always include scenarios of unideal work conditions. And I think that is so important so that when they go out into the field, they're not thinking that they're walking into this public school and everyone has a perfect book and every classroom is perfect and the teacher has been teaching for a decade and everyone's perfect. They need to walk into these conditions where they're thinking, oh, I'm working with the teacher and they have no idea what a speech language pathologist does. Or I'm going into this room and actually I don't have an office. And so how am I going to work with students when I don't have a dedicated space? Or I'll say, for example, that they're going into a school and they're working with a student who speaks a language other than English, and the teachers only speak English, but all of the paraprofessional staff also speak the student's home language. And all of the students will always say, well, I'm going to wait for an interpreter, which is exactly what the textbook will say, which is a great answer. And I'll say, okay, well, you put in for an interpreter and they'll be there in about 6 weeks. So do you want to wait 6 weeks to do this evaluation, or how can you adapt? And they'll say, wow, I didn't think about that. So being able to think through what are some practical things that are likely to occur to them when they're out in the field, and how can they adapt? So I always try to take a scenario that they can work with, and I'll incorporate that as my class assignment. So, and I always tend to weigh that assignment equally with a standard kind of test that they're used to, where they'll sit and they'll test. But I always try to incorporate a case study, a report reading, a report interpretation, a client lesson plan as one of the graded items in the class, beyond just did they, take a quiz and read, and, the quiz shows that they read the chapter. I want to make sure that they're able to integrate that information. I also always have them at this point, I always have my classes do these clinical case studies as presentations, so that to the other students we can all have an open conversation and learn from what they prepared. We can talk about where we might make some adjustments and when I make some critiques. And I want all of the students to benefit from hearing all of these different cases and thinking about all the different possibilities that might arise with this particular client based on the profile. And so it really allows for a more collaborative learning experience, which I think is really helpful. And it also really allows me to tie in all of this clinical knowledge and background that I have, where I will say, well, my client, Devin, who's 17 and turning 18 and said he is an adult and he is going to move away from home, instead of trying to force him to stay home, let's come up with some activities that are going to help him be independent and maintain a job and get an apartment. And so thinking about things that are very practical, that they're able to then see in the real world once they start working clinically. And the great thing I've always had is students will email me after the class and say, oh my gosh, when I got in this clinical placement, that's exactly what happened. Or they'll say, oh my goodness, so-and-so also didn't know what to do. And I was able to use that example from the case study and, I was able to know what to do in that scenario. And so that gives me a lot of joy and excitement, knowing that using this approach, being more clinical, pulling in things of that nature is really helping them learn. With pulling in clinical case studies, I will add that it's really important to figure out what you want from them as an educator. What exactly do you want them to learn and glean? And then my strong suggestion is to develop a rubric for grading based on what you want the learning outcomes to be, that should be connected to your student to your standard course outline and to those student learning outcomes. So I will write in the grading rubric, the student demonstrates flexibility in regards to counseling clients, and they'll have to demonstrate that in real time. And I'll point out where maybe they made some missteps and how they could adjust for the future. So something to just consider there as you're thinking about clinical case studies. You want to then develop a rubric for grading, so that students can help to tie in that clinical piece back to the grading classroom piece. And next slide, I think. I just want to also touch on really quickly just things that you can use in your classroom setting. Again, prioritizing the student's perspective. So the use of rubrics is going to be really, really helpful there, so that they're really itemized in terms of looking at what they're going to be graded on. And then just linking the textbook to the real world. So always including videos, observations, client cases. In a lot of my cases, my classes, I will have either a practicing clinician who, saw a client that morning come in and do a guest lecture, or I will have clients themselves come in and do a guest lecture, or I will have parents of clients come in and do a guest lecture again. So they have to connect what they're learning to real people. And I think that's really important so they don't become so fixated on, I got an A because I did really well on the quiz for chapter 2, but so that they're really thinking about this information as it relates to their future clinical practice beyond the grade. And thank you so much. I put my contact information at the end. I'll also put it in the chat. And thank you all so much for listening. We'll pass it
Thanks
off
so
to
much,
Heidi.
Dr. Dougherty. All right. So our next speaker is Dr. Heidi West from Health Science.
Hi, good afternoon, everyone. Thank you so much for having this presentation today. I'm really excited to be hearing from the other panelists as well. I will apologize in advance. I have to sign off a few minutes early at the end because I have to teach. So I will also put my contact information in the chat just in case anyone had any specific follow-up questions for me. Happy to talk more at a later time. So I am from Health Science. If you want to go ahead and go to the next slide. For those of you who don't know the degrees that Health Science offers, we focus in mostly public health. So we have a bachelor's of science in public health, master of public health, and we'll be offering a doctorate of public health with our first cohort starting in September of 2025. So very exciting to have that coming out. And a lot of our students are going on to be working in community health settings, health departments, or in health education oriented roles, in addition to some of these other roles that you see here up on the slide. But we are working to train health professionals who are person-centered and sensitive to diverse qualities and the changing face of healthcare delivery. A lot of our undergraduate students are also interested in more of the clinical health sciences, but want to have more of a population or preventative health focus to bring into their future clinical practice. And so they'll start here in the health science department before moving into that space in graduate school or further professional training. So I come to public health also, as everyone here on the panel, with a wealth of professional experience. So I worked for well over a decade, but in a very untraditional way. So I started out thinking I was going to be a lawyer. So I was paralegal. I worked in the law field. I worked in program development and doing a lot in international programs before moving more into the global health space. I also have experience developing and creating an international NGO from scratch. So what does it take to actually build up an organization that then hires people within the field of public health? So one of the things I like to do early on with my students is to share a lot of this experience, share the non-traditional path that I took, and open up that space for students to share their own experiences and their path as well, so that we have this space where we're understanding that there isn't one straight, narrow way to get where you're going in your career. And so that's something I like to also kind of bring into the classroom and emphasize that. You can go ahead and move to the next slide. My work is really my foundation of the way that I teach in the classroom. My teaching philosophy is in the feminist tradition, primarily in relational ethics. One of the reasons this is fairly relevant to our discussion today is there's a real emphasis on lived experience, valuing perspective and context, and the real experiences that people have in their everyday lives, in addition to the importance of connections and seeing things, valuing our world, making decisions based on the connections that we have within that everyday life, everyday work. And so I bring this into the classroom in ways where I really focus on facilitating connections. So I try to help the students to find connections to the content, find connections to the topic. And often that is taking us outside of the textbook, taking us outside of journal articles and what we're seeing in the library and in the classroom space, and moving out to what we're doing in our professional lives, what we're seeing in our own communities. So really helping students to connect to the content, to the topic, and facilitating that connection. Similar to what I said at the beginning, opening up myself and kind of being an open book to students to help them connect to me as a faculty member, but also to the wide range of professionals that are in my network. So I like to really make sure to help students to connect to other folks that maybe they can do informational interviews with, and really incorporating some of that professional development and professional learning into our more content-based learning in the classroom as well. So when we'll have modules around a particular content or particular topic, we'll also think about who are the professionals that relate to that and what are the professional skills that they exhibit. And for students who have an additional interest, I will offer up some of those connections to them as well when relevant. Facilitating connections between classmates. So a lot of that's done through teamwork, having students work in teams and understanding and getting to know the other students in the class. And then because of the topic in public health, we're often working in communities, we're talking about larger populations, helping students to take this work back to their communities or other communities of interest for them based on what specific areas of public health they might be interested in working in the future. You can go ahead and move to the next slide. So what does this actually look like? What are some practical ways that I incorporate this? So thinking kind of in two different domains, the environment of the classroom and the content, and then the skills development, the learning of the students and how we assess that learning. When it comes to environment, I touched on this a little bit, but making sure very early on in class to create an open space, a space that really invites these connections to come about. So in addition to doing this in the actual class itself, when we're all meeting together, I create discussion board spaces. These are spaces that are not, some of them are required discussion boards, but then we also have more open ones where people post opportunities, where people post where they work, where people are able to share things that are coming up in their lives or in their work that might be relevant or of interest to someone else in the class. So we have spaces where we're talking about books that we're reading outside of class, volunteer opportunities that people participate in addition to our required discussion boards for the class, really being a space where people are sharing how this work is happening outside of the class itself. What are their community or familial or personal connections to it? When it comes to the content of the course, so very similar to what the prior speaker mentioned, bringing in a lot of case studies, and often that'll happen through guest speakers. So utilizing my network to bring in guest speakers who are sometimes experts in the field, but oftentimes people who are actually having more lived or personal experience with the topics. So for example, I teach a course on HIV/AIDS policy and advocacy. So in addition to bringing in clinical professionals, people who have experience in the policy space around this, I also bring in the stories and narratives of people who are living with HIV or people who have lost someone they love to HIV. So thinking about how does this actually play out in the lives of real people, and how can we learn from that so that the work that we're doing can have the impact we're seeking to have. For other additional content, looking beyond the textbook and utilizing real resources that are utilized by public health professionals every day. So the United Nations Sustainable Development Goals is one example of that. In the US, we have Healthy People. We're currently on Healthy People 2030. For the HIV/AIDS course, we use the UN AIDS data dashboards. So when we're pulling our information, when we're reading and learning about these different topics, we're utilizing the resources, the data, looking at the goals and the targets that we have set as a nation or as a world, and that the public health professionals are using on a daily basis. So rather than maybe more historical cases or things from a textbook, we're utilizing these resources that come about every day. When it comes to development and assessment, I like to give choice of topics. So thinking back to those connections, linking these topics to the relevant sustainable development goals, healthy people, et cetera, but allowing students to really choose what they want to focus on in the class helps them foster those connections, and then also can link it back out to their own professional development and the connections that I may have in that field as well. Linking assignments and the way that assignments are completed to competencies and skills development. So as I said, working in teams, having a lot of presentation work, and utilizing types of assignments such as writing policy briefs, writing program plans, things that people will do in the professional world. And similar to the prior speaker, bringing in actual examples of ones that I have written in the past in my own work. So these are coming from the real world and linked to prior professional experiences that I have had. For exams, making sure that they're focused on application of concepts. So bringing in examples and asking them how they would respond in that particular example, rather than doing definitions or memorization and that kind of thing. It does mean that the exams tend to be a little bit harder, but they then are more relevant to our overall learning. When it comes to the types of assignments, I have courses where we actually do things out in the community. So taking it out of the classroom and doing direct civic engagement, offering a real variety of options for that, though, to ensure that the opportunities are relevant. They make a lot of sense, really talking to people and folks that I know in the field to see where can student voices and student perspectives and student skills really make a difference in this space, and then offering a wide variety of the type of engagement that students can do to allow for accommodating different schedules, different learning styles, different levels of comfort, whether they're doing something in person or virtual, synchronous, asynchronous, etc. And then the final thing that I'll say is just making sure that the assignments are really done in an iterative way. So thinking within the professional world that I have experienced, you don't just write a grant proposal, turn it in, get a grade, and that's it, right? It's a process. It's developed with a team. You're getting feedback. You're doing drafts. You're constantly improving things. So ensuring that the assignments themselves and the process of grading and assessment are done in a way that would reflect how things might be done in a professional setting. So having opportunities for improvement, multiple chances for feedback, and understanding where things can be improved, how people can draw on the strengths of other team members, and kind of bringing that throughout the entire semester, rather than having kind of a one and done type of paper, which doesn't reflect how we typically work in the world of public health. So that's all I'll say for this. I hope some of this is helpful, but yeah, thank you for your time.
Thanks so much, Heidi.
Thank you, Heidi.
Thanks so much, Dr. West. All right, so our next presenter is Dr. Pamela Sandre from the School of Nursing. Oh, Pamela, it looks like you're muted.
Sorry. Now, can you hear me now? Okay. So my name is Pamela Sandre. I'm a nurse practitioner, and I have 40 years clinical practice experience. That tells you how old I am. And when I came to the classroom, you know, like 15 years ago, I was thinking, I just wanted to teach and pass my experience to the new generations, but I didn't understand all what is behind the classroom, you know, the teaching and the classroom to be effective with the students, because you come with a passion, but we are not actually training pedagogy, which I have to be going through the years, you know, teaching myself and taking courses and trying to understand how to be more effective to deliver all this experience that I have from the clinic. I'm actively working in clinic today. I'm a clinician also. And one of the things that I realized that the students, you know, the nursing program has undergrad and grad programs. My experience is completely on the grad program, but you all know that nursing comes, you know, the registered nurse come first in the undergrad. And after that, when you do the advanced placement, then you take the graduate program. So the population of the students in the graduate programs are basically adult learners. And pedagogy, as a term from the Greek roots, it means like education for the children. So andragogy is the one that we really want to apply to the adult learners. So my students they're already professionals, so they're very clear about what they want to achieve, and their expectations are very high. And being a clinician, they have to achieve mastery of the content that they are learning. Is not just to memorize, like many of you mentioned before. And that part, like to canalize and obtain a clear results and making them successfully to be healthcare providers, which is constantly changing because the healthcare system now is completely under corporations. So you don't have any more like your patient relationship that we used to have. You belong to a corporation where they're like really talking about how much you produce, and there's a lot of economics involved in the situation. So in order to bring this to the classroom, can we go to the next slide, Virginia? The next one. Okay. It's very important that we have a good student learning, objectives, because these are our learning goals. And when we know that when we have them organized, they're gonna help us to deliver appropriate instruction, and also will help to design valid assessment tasks and strategies. And all instructions begin with the knowledge, skills, and actions that you want your student to obtain. So these objectives actually are going to help you also to see what type of strategies are you going to use. You want them to explain, you want them to demonstrate, you want them to discuss, etc. And then it will ensure the instruction and assessments will be aligned with these objectives. Can we go to the next one? So in order to apply all this pedagogical knowledge in the room, we need to know what is their background. All the registered nurses come with different specialties and different backgrounds where they were applying their professions and their careers. So we need to choose appropriate instructional strategies that it will fit everyone. And that makes the room very diverse, and that makes us, they force us to be really individualizing the way that we teach. We cannot just be a lecturer and be there for 3 hours talking to them. We noticed that these new generations they love to be self-taught. They're the YouTubers. They like to discover things. They don't want to be, acquiring knowledge just because. They really wanted to get into the why, how, and for all that, you need to be very open and keep up with the new trends and include those in your classroom so they get really interested. They get really bored if you are like 3 hours talking. So you need to have case studies, you need to break in groups, you need to make them find out things, discover new knowledge themselves, and that will help to keep their attention span mostly through this very difficult time, because most of them in the undergrad, they already learn pharmacology, they learn patho, and now, when they took those classes, they passed, they got an A, and they're usually very good students. So they put all the knowledge to sleep. Now they have to apply it. All the pharmacology they learn is very different when you have to prescribe. Now you have to know you can't memorize just the name. Anybody in the clinic can call a pharmacy with a prescription, giving the name and the dose. You're the one who's going to decide what is good, what is bad, and why the mechanism of action is not going to be interfering with other meds, with other things, with the diagnosis, etc. So it's a completely different world, and you have to reflect on the way that you teach in order to improve. Because through the years, we all realize if you keep teaching the same thing, like you will never improve. And that's something that it was always like very interesting to me to think medicine changed so fast, like the iPhones. And I always tell the students I wanted to practice with the last iPhone on the market. all medications, all diagnoses. After the genome, we keep, changing our lectures, our slides, everything, because every year we have different new things. And that's very challenging when you thinking about the classroom to be what you have to deliver to them. Can we go to the next one? So in undergoji, we, like I said before, we have adult learners. So adult learners in general, they need like a quiet environment and through consistent high expectations. But also we have adult learners that are different type of groups. Some of them are very young, some of them are older. So what I try to do is mix them up and get groups with different type of experience so they can support each other, discovering all the process, how they're gonna become good nurse practitioners. And you also have to be very responsive to the student needs because they all learn in a different way. Sometimes you get students that they need a little more of attention. The classroom management strategies are very much related to this, to the diversity, to the background that they're coming, the knowledge they're coming with is completely different. I have a lot of international students that they have a lot to give us, but they also need a lot to learn from our system. And when they go into the clinical areas, it's really hard for them to understand the process. United States has a healthcare system that is very difficult. We all know that. And multiple of insurance. And then when you work with the underserved, you go into the other extreme where you have nothing to work with. And so you also need to learn to be creative, to be, able to be flexible with the situations like Belinda, Dr. said before. You're not going to find every textbook in every single case that you see. It's very important that they see you as a mentor too. And sometimes we forget that you learn more from what you see than actually what they tell you to do. And you got the privilege to show them. And I usually tell them case studies that in my assessment that are actually my patients. And sometimes I have seen the patient the same day I'm teaching. And they get fascinated because it's very much related to today's days. And they can see themselves working with this, and they see how difficult it is because this is a puzzle that you have to solve in a room. You can't tell a patient, oh, I didn't get an A in that part of the class, so I can't give you a diagnosis. I cannot do a pap smear because I wasn't good at it. The patient doesn't really care if you write well. It doesn't matter what grades you got. They're there for you to solve a problem. And if you don't know how to do it, they have to learn how to approach the patient saying, we don't know what this is, but this is the plan. This is how we're going to work it out. So they really understand that you care about them. Can we just go to the next one? And that's the reason why for my assessments, usually, mostly we use case studies. They also do group presentations. They do group assignments. And for the content that you have to really know by heart, it will be like a multi-choice test. Because we also have to prepare them for national certification, and they have to pass the board no matter what. So they need to also practice how to read questions, how to answer what they're asking, and how to detect, like all the distractors in a question. So we have to have that multi-choice test, even if we didn't like it. The next one. Like I said before, I'm a nurse practitioner, and that's what we're teaching right now. I am double certified. I'm family practice and women's health, but my passion is in women. So I have my whole life trying to advance with women's rights and women's health. And we have to have a graduate level degree of education. And also today's days, nurse practitioners get the same exact patients like the physicians. When we have the advantage when we start that we were nurses before. Usually the physicians come to be a resident and they have never been with the patient. So that gives us a little bit of a advantage with the skills of communicating with people and bedside manners. You know, we know how to talk to a patient because we were nurses before. Although we were trained a little bit different when you're in the nursing field compared to have to make decisions, because as a nurse practitioner, you assess, you diagnose, do you prescribe, order tests, and refer all that together. But you have to be able to also listen to these patients. And that's our major skill in comparison when we work with the physicians, because the medical model is a little bit different than how we started. So it gives us a little bit of advantage, like with the patient's relationship, because we get that closeness and we are used to be listening to the people, you know, that we are treating. So we share most of the same duties. Corporations today, they also use call centers. They just fill out templates with appointments. They don't care which, you know, if it's a PA, MP, or physician, they put patients all over. Is the billing what is important? So that is a big challenge for us, because you wanted to do more in a very limited time, and you have to learn how to manage that time to be effective and have the patient feel like they were heard, because most of the time they're really frustrated. They get 5 minutes consult and they wait for hours to be seen. All that we need to translate that experience into the classroom and make them realize that you have a lot of dreams, but not all of them are doable, at least until you get, you know, trained to be fast, to assess fast, because in the beginning you're so still unsure of your skills and knowledge that you're so concentrated not to make a mistake. And it's hard when you're a new beginner. We also train them how to get a job, how to get a contract, how to look for what they're offering. As nurses, we have been trained like almost like you don't deserve to be paid. And we feel terrible when we have to negotiate a contract. We almost don't want to even talk about it, whatever, you know, happened there. So it's something that we need to learn in school to be able to advocate for ourselves. I think that was my last one. I put my information also during the chat, and I was planning to do a little more about the pedagogy, but it was covered during the first part of the, and for the sake of the time, I don't want to go more into that.
Sounds great. Thank you so much, Dr.
Thank you.
Sandre.
Thank
All
you.
right, so our fourth presenter for today is Dr. Delikian from the
Hi,
Department
everybody.
of Computer Sciences.
Hi, thank you for having me. This is such a great opportunity to hear from everyone and share a little bit about my perspective. I'm probably the newbie on board. I've been teaching at Cal State Long Beach. I'm just wrapping up my third semester, so I'm very new here. I have been a clinical psychologist for over 20 years, though, so that's where my mastery and expertise is in. I do specialize in treating trauma, childhood trauma, with adults, as well as family of origin issues, family dysfunction and stress, domestic violence. I also have an extensive history in conducting psychological assessments, including IQ tests, academic tests, learning, ADHD, and the whole spectrum of learning as it relates to cognitive abilities. But my heart and my passion is in trauma and helping adults and young adults heal from trauma that was caused in their primary attachments, primarily. I also do EMDR therapy as well. So that's a little bit about what I bring into this. A lot of your stories resonate with mine. I was so excited to throw myself in the world of education and be part of an academic community. I wanted to share psychology with students because the only people who I share psychology with are my clients, and I don't get to have too many with limited time. psychologist interacts with very few clients along the way. So it's a much more powerful experience, you know, in a given semester to interact with 100 students and share this information with them. So that has been an incredibly rewarding process for me. All right, I guess we can move on to the first slide. This is just sort of a general definition of clinical psychology, which basically encompasses obviously the world of mental health, the mind-body connection, managing interpersonal relationships, spiritual well-being, and so on. We are doing lots of levels of intervention at the same time, managing crises, chronic stress, old stuff, childhood trauma, inner body work, healing, and developing introspection and critical thinking skills along the way. So all of that is the work we do as psychologists and therapists in the room. And my challenge has been how to bring that into the classroom and to use as much of the strategies I use with my clients, with my students, with the goal of increasing their ability to learn and to learn in a visceral way, to learn in a deep way, and not to learn in terms of memorizing and test taking and just for grades. And I think everyone has touched on that as well. Okay, next slide. So as a therapist, I teach my clients the science of psychology in an artful way. So that's my intention with my clients as I sit in the room with them. How can I transfer this very complex information into a way where they can digest it and really feel it deeply so that it can activate some level of change for them. And always I'm looking for ways to make things personal and meaningful, use a lot of metaphors in the therapy space, metaphors that are relevant to the client, whether it's their work, their hobbies, their passions. So any metaphors that I can come up with that they can connect to is one way of making things personal. And always approaching sessions with minimizing any shame or judgment and modeling compassionate inquiry and teaching them about compassionate inquiry into themselves. So I'm trying to move that into the classroom where I feel that my job is to teach the students the science of the course material in artful ways and coming up with creative ways on how to do that. Also, again, to make complex information, dry information more personal and meaningful. And approaching students' participation, questions, inquiries with a lot of compassion and enthusiasm. Because particularly the things that I'm teaching, students get activated. Obviously, there's a lot of history students bring in with them. I would say the majority of students carry some level of trauma or have had some history of dysfunction in their lives. So this class can be very triggering for students. And I am aware of that and take things with a lot of empathy and really sort of help them walk through the dense information we get through. Okay, next slide. Some things that I continue to think about and hope to tweak and improve every semester is creating the environment of developing critical thinking skills and not just memorizing. I I think that's a little bit of a pet peeve of mine. I have a teenage daughter at home who spends hours a day memorizing information to go take tests, and but can't really deeply digest the information or really want to talk about it. So I try to avoid as much memory tasks as possible. I really want the information to be much more personal and much more engaging and active. So I definitely try and do more active participation over passive note-taking. One of the things I have tried this semester is that I have freed my students from taking notes for the entire time. I have given them a lot of my notes that they can access anytime that they want. And what I ask in return is a lot of class participation. It's a lot of discussion and doing different activities throughout the class so that they can, again, experience a visceral learning process rather than just a cognitive learning process. And the reason for that is that whenever we learn things through our body, that sticks to us on a deeper level. So a lot of true change or a lot of growth comes from bottom-up processing versus top-down processing. So I try and make sure I do things in the class that contain bottom-up processing, so the students really feel the material. And I do that through case examples. I try and share as many of my cases as I can, and I have lots of gnarly cases to share, so sometimes they struggle with hearing the information, but I think again, the more personal and the more character-driven the information is, the more powerful it is to retain. So I also like to show a lot of movie clips in class because when students can connect with the characters' issues, then the information also sticks better. So when instead of just maybe listening to TED Talks, that in addition to more educational videos, I'd like to incorporate a lot of movies and TV shows where, again, it's character driven and the students are connecting to the issue, the human experience, whether it's the human experience of suffering, of loss, of joy, of connection, of abandonment, of rejection. Whenever a student sees an example of that, they find a way to connect with the material more than the textbook reading. One of the things I am implementing is the multimodal teaching. What research is showing is that it's not that people necessarily have individualized learning styles, even though that's something we've all believed, that we all have a particular type of a learning style. Actually, research is showing that everybody learns better with multiple teaching styles. So everybody learns the information better when it's presented to them in a visual way, in an auditory way, through reading and writing, and through a kinesthetic way. So I try and incorporate those 4 modalities in my classroom time. Visual, again, would be videos, and especially character-driven videos or animated videos that I know today's generation enjoys. Auditory would be just, again, class discussion, some lecture, discussing cases. Reading, writing is access to their textbook and to the notes and to the PowerPoints. And kinesthetic, I'm always trying to find ways to create movement in the classroom. And a lot of times we use the whiteboard for that. I break students up in groups and they present their information on the whiteboard just to get them moving. Or I'll bring in some of my play therapy equipment and we'll do a little bit of play. I have different activities where I make my students draw things, because drawing, again, is very visceral and it gets to the core of learning. We use gadgets. For example, one week when we were discussing mindfulness, we had a mindful eating session where I brought in some candy and we had to mindfully eat the candy. So I'm also thinking of incorporating more games and more fun ways to digest very difficult information. One thing I noticed, because I'm always looking for stress in students, I was very surprised when I started teaching how many emails I get from students about expressing their levels of stress and chronic stress and how overwhelmed they are and how many life difficulties they have. And I noticed that in the classroom, and I noticed that there is some type of functional freeze in students, which is the sense that a student is very overwhelmed because of chronic stress. So they show up in a little bit of a trance, and that they just sit. And a lot of times they use their devices to not engage, or chat with their peers next to them. They're just this lifeless energy, and they come in, and it's the easiest thing for them to be passive students. But I do think that that is coming from just the difficulties of the modern world and how much chronic stress there is. And I see it in them and how difficult it is for their bodies to move, for them to engage, for them to talk, for them to emote. So that is just something I'm noticing. I'm taking note of it, trying to figure out how to help them with their functional freeze in the classroom. One of the most important ways to break the freeze response is through movement, through moving the body and through breath work. And so it's a question mark for me on how I'm going to address that and help maybe break some of the functional freeze I'm starting to see in students semester after semester after semester. And I think that's it for me.
Thank you so much,
Mhm.
Dr. Delikian. I think we're
Mhm.
going to have to invite you back later as you work through that some more and have more dialogue on that stress response, because I think we probably all see it in our classes. So thank you all so much. I know we're getting close to time, so I'm going to skip over to that questions slide. If you'll have questions or comments, you're welcome to put them in the chat. But I did want to close us out today on some resources for those that are looking for ways to improve their instruction. And I really do want to thank a new lecturer like Dr. Delikian for joining us today, because as we've seen, all of us bring these experiences into the classroom, and a lot of us in this college are doing on-the-ground training for students who are heading out into really skills-focused careers. And so that experience that we bring in, when we learn to channel it in the way that really helps those students develop the skills is really helpful. So here are some resources through the Faculty Center. I just took a screenshot of some of the opportunities that our Faculty Center is offering. At the bottom right there, you see this faculty formative feedback program. I participated in this program a couple of years ago, and it's a great way for instructors who are wanting to gain more skills to have a mentor come alongside you, visit your class, and give you feedback. One of the things I took out of that I always incorporate since is to, beyond just the class objectives, come with 2 or 3 main ideas that you want students to leave the session with, and then tie everything that you do in that class to those main ideas. So I started writing these kind of student-focused, less academic sounding main ideas for each class session. And I really felt like it was a way to organize the content in the way students could really leave with a sense of, here's what I'm going out of this class with today. So I really encourage you all to check out those resources through the Faculty Center. And then also academic technology. Lots of training is available through academic technology, whether you're working on shifting a course online. And often those trainings have some pedagogy woven into it. I remember also taking a hybrid training through ATS a decade ago and really learning how to tie objectives to activities and assessment. And then lastly, peers. Invite a peer to your class. Learn from, have discussions with other faculty about how they are solving some of the things that you're seeing in your classroom. So I really just encourage those conversations with peers, and again, inviting someone else into your class space or visiting someone else's class space and seeing how they're doing that. So we really appreciate you all for joining us today, especially to our 4 speakers and to those who joined us as our audience. And we hope you all have a great wrap up to your spring semester. And if you have any questions or comments, you're welcome to stay on, but I know we are at time, so you're also welcome to head on with your Monday afternoons.
Thank you so much.
Thank you.
Thank you. Bye-bye.